The single biggest provider of healthcare in North Carolina is about to kick hundreds of thousands of people off the care they depend on, and most of them do not know it yet. These guys pay for 1 out of every 3 childbirths in the entire state of North Carolina, like 46,000 babies a year. They also cover the healthcare of 1.3 million kids in North Carolina. That is 41% of all children in our state who are able to see a doctor and get basic treatment today. They also pay for 70% of all seniors in nursing homes in North Carolina. 70%. I'm talking here about Medicaid, the federal government's healthcare program for low-income people. For 59 years, Medicaid has been America's de facto healthcare safety net for people who don't have a whole lot of money. And the bottom line is that Medicaid covers 3 million North Carolinians today, almost a quarter of our state. To give you the right sense of scale on this, there are more people on Medicaid in North Carolina than Baptists and Catholics combined. Imagine every single person in our state east of I-95, every single one. That is still less than half the number of people on Medicaid. So yeah, it's a lot of people. Right now, Republicans in Congress are proposing massive cuts to Medicaid that will kick about 500,000 North Carolinians off their care, about 16% of all recipients. Now, you might remember how last year during the campaign, Donald Trump swore that Republicans would never cut Medicaid, but Trump says a lot of things that aren't true, so add one more to the pile. Children, low-income people, disabled people, seniors in nursing homes in every single part of the state will lose their coverage, including hundreds of thousands of people in Republican districts whose members of Congress just voted for this thing. These guys voted to take away healthcare from their poorest residents. And it gets crazier. These massive cuts to Medicaid do not reduce the federal government's debt. In fact, the Republican budget bill adds $3 or $4 trillion to the government's debt. And the reason is because it also includes very large tax breaks to wealthy people. They're literally paying for tax cuts to our richest people by cutting healthcare to our poorest. This bill passed the U.S. House and is currently in the U.S. Senate, where North Carolina's Republican senators Tom Tillis and Ted Budd are reviewing it. The best hope here is that maybe some Republican senators will ask to soften those cuts a little bit, but don't hold your breath. There is just no dressing this up. This is going to be ugly. Many of the people who are going to lose their health care about this don't know about it yet, and when it happens, they won't exactly know why. So what you can do is make sure they know exactly who's to blame.